So I wanted to get into something as far as surgical PAs are concerned with job satisfaction and which field you may be drawn to. And I just want to let you know that it's not just what field you're in that's important. It's, I think, for the most part, who you're working with. Because I've had, in my neurosurgical days, I've had some surgeons that I work with that were amazing and hands-on and let you do what you were able to do and actually use your skills to your advantage and to their advantage. And actually, there's a big fundamental difference in first assisting and the true form and just being there. And that's surgeon dependent. Doesn't matter what you can do. If the surgeon you're working with isn't comfortable with the PA or a nurse practitioner doing certain things, they don't think you could do it. They're not going to want to see you do it. They don't think it's even on the table for you to do it. Their vision of what a PA or NP can do is only so high. So when you work with a surgeon like that, it's very frustrating. And if that's your first experience, is getting into a surgical field and that's the surgeon you end up with, that can cloud your mind into thinking that that's how all surgeons are. Now, you probably had some training in school, maybe, that you were with a couple different surgeons, maybe, but that doesn't really even count because you're so fresh that you can't even appreciate what you do and don't know at that point. So it's hard to gauge anything from school. But once you get into it, if you're getting super frustrated and you feel like you're not able to do much of anything in the OR, give it some time. If it really is your first go at it, you need to learn. Obviously, there's a learning curve, steep learning curve, and when you can actually be fundamentally sound and fluid in what you're trying to do in the OR, that takes time and experience, obviously. You can't expect to just jump in and put in a pedicle screw. But there's so much variation that comes with every surgeon you work with. And once you have the experience, it's so easy for you to tell. It's hard to explain that to someone that doesn't have the experience, but once you do learn and you've been with some that are good, you've been with a surgeon that really pushed you to do more, learn more, do more, actually help them out, make them more efficient, going backwards to other surgeons is like a slap in the face. It's insulting because they don't want you to do anything. You're just kind of a retractor holder, or you're just kind of there to suction in their minds, and you're almost meaningless because they want to do all the work themselves. Not necessarily their fault, it's just everybody has their own comfort level. So when you're in these surgical jobs, if you have the experience, it's easy to see. But if you don't think just because you get into ortho and or you get into one surgical field and you feel like you can only do so much, see if there's other options for you to jump in the OR with other surgeons, even if it's not on your hours you're supposed to work. Try and get some other experience with other surgeons that may be in your group or within your hospital, just so you can get a feel for a variety of options. And then maybe you jump in with another surgeon and like, oh, he let me do this and this and this. The guy I've been with for 6 months just started to let me close the skin. Like, so try to test the waters. If you're in a private practice and there's only one surgeon, obviously that's not going to work. But if there's other guys, if you can, volunteer yourself into being on call with some guys just to get some extra experience, do it. If you have the time, if you're just getting into it, do it. It's worth it. That way you know before you turn the page and say, this isn't my specialty, I don't want to do this, you got to test the waters. Because there's the good surgeons, there's bad surgeons. Not that they're bad surgeons, they never get trained with PAs, so they don't know what you can and can't do. And that's not their fault, it's just independent surgeons based on their training. So they may have had a really bad experience with a PA or a nurse practitioner at some point, and now they're hesitant to let them do anything. So things happen, people do things for a reason, and just remember that. Test the waters, and don't give up on a specialty just because you have one bad surgeon. Doesn't mean the whole specialty is bad. There's a lot of other things you like. You like the clinic, you like the other parts of it. Just when you're in the OR, you don't feel like that's your thing. Whether it's a comfort level or whether it's the surgeon, reassess. Try to get some other experience. And I think it'll help make your decision, help pave your way to finding where you should be.